Hi everybody! Today we're talking microneedling. So microneedling, just the basics. What is it and how does it work? Then we'll get into many different types of microneedling. So microneedling plus topicals, microneedling plus platelet-rich plasma or PRP, also known as the vampire facial, microneedling and exosomes, which is really new, microneedling and radiofrequency, things like Morpheus 8, and then microneedling to inject things into the skin. In office, it's the Aquagold system. At home, you can buy Qure. And which ones actually work, or is it all bullshit? Baloney. Now, back to basics. So, what is microneedling? Microneedling is also known as collagen induction therapy. It's a device that looks like a pen and it has tiny needles that go up and down very quickly, and we roll that across the skin and it makes these tiny punctures in the skin. And the point of this is so the needles go into the epidermis to stimulate it to build more collagen. Before we go further into microneedling, let's go to skin basics. So this is skin. At the very top we have dead skin, or our stratum corneum. Below that is the epidermis. Below that is the dermis, which is where we want to be for collagen induction, and below that the fat. And back to microneedling. So if you get microneedling performed, the person who is performing the needling itself can pick which depth to put the needle at. Our face on average is about 1.5 millimeters deep. Most microneedling devices go to about 2.5 millimeters deep, so there's certainly more than enough for the face, and they can do work on the body as well. Now, how do we do basic microneedling? Well, first, you'll come into the office, we'll put a cream on your face. You'll wait normally for 30 to 45 minutes to wait for it to work, so you'll be mostly numb on the face. Then we come in, we clean the face very, very well because we don't want any infection getting into the skin. And then we start the microneedling. There's a serum that we put on your face to allow the microneedling device to smooth really gently. And then you'll leave with a red face. All right, now let's get a little fancy. So now let's talk microneedling plus topicals, which is when you microneedle like usual, but you add topicals to the face so they can penetrate into the skin. Common things we use are hyaluronic acid, vitamin C, tranexamic acid, which helps to lighten the pigment in the skin. Does this actually work? So let's look at a study. This is a study out of the University of Miami, and they're asking the question boiled down to, for patients with melasma, which is darkening of the face, what works better, microneedling alone or microneedling with a topical medication? And for this study, they selected 10 patients with melasma, and they did what's called a split face study, which is our favorite kind of study for looking at procedures on the face. So on one side of the face, they did microneedling alone, and on the other side of the face, they did microneedling with topicals. And they found out on the side of the face that was just microneedled alone, the darkness decreased by 0.3 points, compared to the other side of the face that used the topicals, the darkness decreased by 0.8 points. So they concluded from this study the microneedling plus topical, in this case they use epidermal growth factor, enhanced microneedling. All right, the next type of microneedling was made famous by Kim K, our favorite, and this is microneedling plus PRP, or platelet-rich plasma, which is also known as the vampire facial. So what is PRP, or platelet-rich plasma? So say you have your hand, you get a cut, and then it bleeds, but then eventually it stops bleeding. Why does it stop bleeding? It stops bleeding because platelets, which are in our blood, they form a little clot around that injury, so it stops the bleeding. These platelets jumpstart the healing process. So each individual platelet, it's chock full of growth factors, which help to rebuild the area, and mitochondria, which is, say it with me, the powerhouse of the cell. It has a few different types of growth factors, and that helps to rebuild the epidermis, the vessels, etc., so then you can heal and your hand heals up. So what does this process look like if you want to get it in the office? Well, you will have your blood drawn from your arm, then we'll spin it down in a centrifuge, and then we'll take a certain part of the blood that's rich in platelets, which is rich in those growth factors, and then we take that and we microneedle your skin with that serum on. So then it gets into the skin and provides your dermis with those growth factors. So what about PRP? Is this baloney? Well, a study came out of India, and they looked at also another split face study, and they were asking the question, for patients with acne scars, what works better, microneedling alone or microneedling with PRP? In this study, they looked at 30 patients with acne scars. And again, they did microneedling alone on one side and microneedling with PRP on the other side. And they found that the side with microneedling alone, 20% had an excellent response, versus with the additional PRP, 43% of patients had an excellent response. So the conclusion from this study was that microneedling plus PRP was more effective than just plain microneedling alone. Now, let's move on to microneedling plus exosomes. So this is a concept that's similar to PRP, though the exosomes are not coming from your body. So what is an exosome? An exosome comes from a healthy donor, and in this case, we'll use fat as the resource, but exosomes can come from different types of cells, but today we'll say it comes from fat. So then they harvest the fat to get these stem cells from this area. So they are adipose-derived stem cells, or fat-derived. They grow these stem cells, and these stem cells contain so much information. They can potentially turn into a fat cell, or cartilage, or bone, or muscle, skin, vessels. They contain so much information. You think of them as like a coach, like a football coach. And then they culture these stem cells, and then they capture these little exosomes, which are little packets that contain the instructions. An easy way to think of this is that the exosomes are kind of like envelopes with instructions, meaning that they go into the dermis, your cells in the dermis open up these envelopes, they read what it says to do, and then they just do that. If the exosome says to build more collagen, then your skin will follow the instructions and build more collagen. Like we discussed before, exosomes are not FDA approved in the United States. This is a study out of Korea, and in this study they were looking at aging patients, and they asked the question, what works better, plain microneedling or microneedling with exosomes? And in this study they took 28 patients, and on one side they did just microneedling, and on the other side they did microneedling plus exosomes. And they found that the side that had the exosomes had greater improvements in their wrinkles, elasticity, hydration, and pigmentation. So the conclusion from this study was that microneedling and exosome treatment is effective and safe for treating aging skin. And moving on to microneedling plus radiofrequency. And for our purposes, radiofrequency equals heat. And when you add this heat to the microneedling needles, this helps to build collagen even more. Some say up to 10 times more collagen than regular microneedling. The actual procedure itself is much slower than regular microneedling because we take the device, place it onto the skin, it stamps into the skin, heats the skin, and then we pull it out. It's more painful than regular microneedling as well, but the results can be much better. There are many types of radiofrequency microneedling devices. The more common ones are Vivace, Infini, Genius, Profound, and Morpheus 8. This will be a whole nother video that's a lot of information on the radiofrequency microneedling devices. And on to our last type. This is microneedling plus injections, which is also known as mesotherapy. And this is when you're using the needles themselves to inject something into the skin. What you want to inject? It's up to you. In the office, we use a device called Aquagold, and this we fill based on your preferences. If you want to hydrate and plump, we can add hyaluronic acid. You can add PRP as well, as we just talked about. If you add Botox, you can have that kind of glass skin effect. And you can add vitamin C, tranexamic acid, peptides, you can add anything. This is what the Aquagold device looks like, and you'll see here that we push it into the skin, and that's how it's delivering these ingredients. Again, this process is only available in the office. This is not available for home use. A question you may be asking is, well, if I get Botox injected, would I be able to move my face? And the answer is yes. So when you get regular Botox, that's when we inject the Botox right into the muscle, so it weakens that muscle. When you microneedle Botox, quote unquote, you can see it's very superficial, up to the level of like the texture in the pores. So the Botox smooths everything out at this level, and your muscle is untreated, so you can move your face as much as you like. And as you can see here, this is that glass skin effect that people like to have, but is very difficult to achieve. So let's say you're interested in this procedure, but you don't want to bother with going to the office, you just want to do it at home. So can you? Yes. There are a few systems you can buy online. One of the more popular ones is Qure, and this is a device that goes pretty deep into the skin. The Aquagold goes 0.6 millimeters, this goes 0.5 millimeters, so about as deep as the Aquagold that you could get in office. And this comes with 2 different serums, their rejuvenating serum, their hydra smoothing serum as well. And we come to our question of the hour, which is, which type of microneedling is the best type of microneedling? The best type of microneedling is the one that you and your provider feel comfortable with. And for all of these types of microneedling, you're going to need a series of treatments, and it's going to take about 4 to 6 months to see the full result because our bodies are pretty slow at building new collagen.